Imagine you're lying in bed. You turn over to look up at the ceiling, and suddenly, the entire room is violently, uncontrollably spinning. That sudden spin brings on a rapid cascade of physical reactions. You lose your sense of balance, you feel completely unsteady on your feet, and the disorientation is often accompanied by intense stomach upset and vomiting. As terrifying as these acute symptoms are, they usually pass quickly. A typical bout of this extreme dizziness will peak and then fade away in less than a minute. But in that terrifying minute, the sheer intensity of this sensory collapse feels like a massive neurological event. Because the symptoms are so severe and head-centered, people naturally fear they are experiencing a stroke or a serious brain injury. For the majority of older adults or people who have recently bumped their heads, this is a localized issue rather than a life-threatening neurological crisis. This specific type of dizzy spell is known as Benign Paroxysmal Positional Vertigo, or BPPV. This anatomical map tracks the source of the vertigo past the brain and directly into the microscopic structures of the inner ear. BPPV is a mechanical failure of our internal motion sensors. To understand why it happens, we have to look at how those sensors are built to function. Deep inside the ear is a tiny, complex organ called the vestibular labyrinth. This is the command center for your entire sense of balance. This 3D model highlights the first critical part of that system, 3 loop-shaped structures known as the semicircular canals. These are oriented in different spatial planes to act as our primary motion sensors. Inside, these canals are filled with fluid and lined with fine, hair-like sensors. When your head moves, the fluid shifts, bending the hairs and sending precise motion data to your brain. Right next door are the otolith organs. While the canals track motion, these adjacent structures act as gravity sensors, detecting up, down, and side-to-side positioning. To detect gravity, the otolith organs rely on a cluster of microscopic crystals. When you tilt your head, gravity pulls on these crystals, and their physical weight tells your brain exactly where down is. As long as canal fluid tracks motion and otolith crystals track gravity, our biological compass keeps us perfectly oriented in space. But sometimes the system breaks, often for no known reason, a condition called idiopathic BPPV, or occasionally after a blow to the head, those gravity-sensing crystals break loose from their moorings. Once detached, these rogue crystals float freely away from the otolith organs, drifting directly toward the entrance of the semicircular canals. These crystals then fall into one of the loop-shaped motion canals, eventually settling at the very bottom curve. The body's heavy gravity sensors have now invaded the delicate fluid of the motion sensors. It is a physical trap, completely silent, waiting for a simple movement to spring it. The trigger is usually a completely routine movement. You might just tip your head back to look up, or roll over in your sleep. That simple change in angle tilts the semicircular canal. Gravity catches those heavy, trapped crystals, causing them to physically slide through the canal's fluid and create a disruptive wake. That rogue wave of fluid forcefully and unnaturally bends the fine hair-like sensors lining the canal. This creates a massive sensory misfire. The bending hairs send panic signals up to the brain, reporting that the head is in violent motion, even though your body is barely moving. The brain desperately tries to focus your vision on a stable target while receiving these intense spinning signals. This conflict results in nystagmus, a visible biological consequence where the eyes dart rhythmically and involuntarily side to side. That terrifying sensation of vertigo is simply your brain's disoriented, desperate reaction to a microscopic rock sending false motion data. The B in BPPV stands for benign. This inner ear glitch rarely causes complications or permanent damage to your hearing or your brain. However, the immediate aftermath of that spinning sensation introduces a highly practical danger: severe unsteadiness on your feet. This demographic breakdown shows the populations at the highest risk for this condition. The risks overlap significantly for people over the age of 50, those assigned female at birth, and individuals with osteoporosis, a bone-thinning condition. Among these vulnerable groups, the sudden loss of balance leads to a dangerous surge in fall-related injuries and bone fractures. The malfunction inside your ear won't harm you directly, but losing your balance and hitting the ground during a dizzy spell is a serious medical threat. Fortunately, the mechanical nature of this problem means it has a mechanical solution. During a standard office visit, a healthcare professional can guide you through specific head movements to physically coax those rogue crystals back into place. But you must know how to distinguish this benign ear problem from absolute red flags that signal a true medical emergency. This list highlights the symptoms that demand immediate emergency care. If your dizziness is paired with a new or severe headache, a sudden fever, or seeing double and not being able to see well, you must seek help right away. The exact same urgency applies if the vertigo is accompanied by trouble talking, weakness or numbness in your arms or legs, or passing out completely. If the room spins on its own, it's likely a loose crystal in your ear that a doctor can easily fix. If that spin is paired with neurological warning signs, the situation requires immediate emergency intervention.